Écoutez le monde vétérinaire autrement sur Veto Micro, un podcast produit par Temavet.
Bonjour, je suis Marine Slove, vétérinaire touche-à-tout, journaliste et fondatrice de Temavet.
Moi, je suis Sophie Hulford, vétote multicasquette, et je me suis fixée comme objectif l'amélioration du quotidien des vétérinaires.
Bienvenue sur la saison 2 du podcast qui donne la parole aux vétérinaires. Vous entendrez ici des consoeurs et des confrères, praticiens ou non, raconter leur parcours professionnel, avec leurs réussites, leurs joies, leurs difficultés et leurs échecs aussi parfois. En se confiant sur une tranche de leur existence et en interrogeant leur quotidien professionnel, ils nous démontrent qu'il y a 1000 façons d'être vétérinaire.
Nous avons voulu ici nous raconter tels que nous sommes vraiment. Parler de notre rapport au métier bien sûr, mais aussi et avant tout de notre rapport à la vie, à l'animal, à la planète. Ici, pas de tabou, pas de langue de bois et surtout pas de culpabilité.
Vous êtes ici chez nous,
mais surtout, vous êtes ici chez vous. Belle écoute! So hello everybody. This week on Veto Micro, we are going full international and are heading to Australia with equine vet Anushka Vanoppens. Greetings Anushka and thank you for joining us.
Hi, Sophie, and lovely to be here. And thank you so much for thinking about asking me to be on your show.
Super. So, a few words of introduction. Anushka, you graduated from Murdoch University in 2005, and you have been pursuing equine lameness in many shapes and forms ever since. These include the ICELP course with Professor Denoir, that everybody knows over here, of course, an emphasis on ultrasonography in practice, an ongoing course in chiropractics, and several modules with the animal biomechanics group. Obviously, we'll be chatting about all of these. Recently, you moved to Melbourne and have set up your own practice with the goal to approach lameness from a holistic perspective. Anushka, you are also a wife, a mom of 3 young kids, a keen fitness enthusiast, which is a great way to stay level-headed. You also love bushwalking, camping, and going to the beach with your family. Bushwalking, of course, is not something we are familiar with over here, and probably you can say a few words about it later on. So welcome on Veto Micro once again, and I'll start off with our traditional icebreaker, which is, why did you become a veterinarian?
Well, I think I've always had a really strong love of animals, and I started riding when I was 5 years old, nothing crazy competitive. It was just a very simple pony club in outback Australia. This was really outback. And I had a really amazing experience riding horses there, and it was something that never ever left me really. Like, I was obsessed. And this progressed to when I was a bit older, and we went to India for the first time, and I was really overwhelmed by seeing, I guess, the amount of street animals and how sick they were and all this kind of stuff. And so in my head, I was like, right, I'm going to come back to India, being half Indian, and open up a vet clinic and save all the animals. And that never happened. But because the obsession with horses never really ended, I was really focused on becoming a horse vet from day dot.
So early on, you decided you wanted to be a vet, saving animals, and then equine vet was like a sure thing. So how do you set out to become a vet in Australia?
So during school, I mean, I think a lot has probably changed since I went through, but they have things called vocational studies. And so I went into vet clinics while I was in high school to start, seeing how it all worked and if it was something that I was actually interested in. And then I guess once you've got an idea about what you want to do when you graduate, then you have a selection of things that you'd like to do after your exams. And depending on the marks you get in your exams is what you can really apply for. So you get a ranking out of 100. Like on a percentile basis, and then you hope you get in. I missed out by getting into vet by 0.06% or something ridiculous like this. So I had to take a back door in through doing biomedical science, actually, and doing a lot of practical experience in vet clinics to show my dedication, I guess, to the profession.
And that takes how long? Is it over like a year?
Yeah, that was a year. Yes, yeah.
How many vet schools are there in Australia?
I think 7 or 8. There's two campuses which are kind of like a bit more rural emphasis. I guess, being such a large country and there's a lot of outback and, town centres or, big. So I guess being a very large country with, quite a big rural or large countryside in terms of farming and all that kind of stuff, there's a real lack of vets in those kind of areas. Even just, I think there's so much pressure on the veterinary profession these days. Even just townships that are maybe 2 hours from a central city point, they're really struggling to even get vets, no matter how good their conditions are, really, because people just don't want to be, away from the cities, and they don't want to be in situations where they're like the sole in charge and constantly on call. And so I think they set up these 2 kind of more rural style campuses with a view to try and encourage people to get a bit more of an emphasis on, cattle, sheep, horses to, give them the desire, I guess, to stay more.
Is that working? Is it something that's been set up a long time ago?
It was set up quite a while, but I don't know all the ins and outs of it, and I don't think it has 100%, no.
Can you describe for us what the outback is? Because I'm not sure everybody.
So I would describe the outback as, I think there's different stages. Australia really, it lacks what Europe has in terms of these, focal city points, and then there's an expanse of countryside between city points. And Australia, we really have this urban sprawl. So, you kind of, it's a bit of a graduated kind of cityscape outside of the main city centre. But once you kind of get about 2 hours from a main city, I guess, you really start to see a bit more of an isolated experience or feeling. I would say that's probably more countryside for me. And if you were to ask what is real true outback, I would say somewhere in the middle of Australia where nobody lives and it's just red dirt and hot. That's how I would say is proper outback.
Okay,
but Australia has lots of diverse countryside, which is, pretty special. So you can see these more arid regions and the beach and bush, rainforest, snow, like, more alpine kind of environments, obviously in winter. But yeah.
So this is a question I was maybe going to ask you at the end, but coming back to what you were saying in regards to producing vets that are willing to work in rural areas, are you facing like a global recruitment crisis, or is it very specific to those areas?
I think in general it would be a global recruitment crisis. I think people are really struggling to find and retain vets. I feel like large animals is definitely on the back foot compared to small animals. Small animal practice seems to provide a lot more incentives in terms of bonuses and better pay after hours, where I feel like the large animal industry, equine included, that really I've only, in 20 years of working, I've only ever had one job that has paid me after hours. And when things at the clinic weren't doing so well, that was the first thing they cut. And when you're working like a 1 in 3 roster, it starts to get really unmotivating, and people just aren't willing to do that kind of work anymore without being remunerated for it.
Is there any effort put in to the profession, like on the institution side, to resolve these problems?
like there's baseline recommendations in terms of salary, but they're pretty low. I think their minimum wage is like around $40,000 a year. And yeah, there's no recommendations. I mean, there's recommendations for what people should be paid if they're doing after hours, but it's not really legislated. So bosses aren't really obliged to pay a flat on-call fee for the vet on-call, and they're not obliged to pay them a proportion of the professional fees.
Right, that's clear. But surely it might change considering they're struggling to recruit. I mean, they might be forced to make some changes, whether it's the law or not.
Yes, correct. Yeah. And so, Equine Veterinarians Australia, they've just released a new policy kind of statement. So Equine Vets Australia, they've just started implementing new policies for emergency care, highlighting, vets being able to feel more confident, I guess, charging higher fees for emergencies, and requiring payment at the time of emergency service, just to improve, I guess, people's overall experience with providing after-hours care, because that probably is the kicker or the killer, I think, for a lot of large animal vets when they're on call, and going out late at night or early in the morning for foalings or colics and all that kind of stuff. And then when you don't get adequately remunerated for it, either as an employee or as the practice owner, those people don't end up paying their bills. It's really, it's quite hard. And then people obviously also criticize you quite heavily for the amount you charge, even if you're going out there at 2-3 o'clock in the morning.
How would you describe the new generation of vets coming out now?
I don't mean to sound critical, but and I guess this is a bit of, maybe old school mentality. But when I was trying to get into vet school, and every year once I was in vet school, we had to go do farm prac, which meant we went out to somewhere to get more experience within an industry, not just necessarily as a veterinarian. But I filled my holidays with unpaid work. I would go do farm prac. I would go work in vet clinics for free. I just wanted as much exposure as possible. And I just wanted to learn. I was like a sponge. And I feel like people are a lot less willing to kind of just go all in, and really just dedicate themselves to being in a position like that. I don't know, maybe that's just my perception, but I feel like, people want to be remunerated for kind of doing the hard yards, when I kind of see that as a reflection of how bad you want something. But I think overall, globally, there's been a shift in, I guess, what is acceptable or not. So, yeah, I think it's really hard to kind of be too judgmental, because society has changed as a whole. But, yeah, I think sometimes I feel like there's a lot less drive from the younger generation coming through, and really just grabbing things with both hands and being like, yeah, I'm all in and I'm going to do this, no matter how much I'm paid, I'm ready to just, give this a red hot crack.
Well, I think your perception is probably shared, and it sounds like things are very similar all the way around the world as they are in France.
One of my old mentors, Dr. Warwick Vale, he did a recent podcast with the Vet Vault, which was actually really interesting, where they were discussing, I guess, similar things. And I think there's also a component of, because we're becoming so specialized in general in how we kind of progress through our careers, and I guess maybe also part of it is a bit of a perfectionist attitude towards our professions. We want to do everything properly. People are also kind of more hesitant, about getting things wrong. And that may also be a reflection of, I guess, the legal aspects of our profession, when things do go wrong. And so people don't want to make mistakes, and therefore they're less willing to kind of just give things a real good go.
I see what you mean. Yes. Increased risk, and
Yes.
maybe almost also increased insecurities in the younger generations.
Yes.
Well, that's a good transition to go back to your transition from being a student to to a vet. So after graduating, you head to Goulburn Valley Equine Hospital to do an internship, which is actually where we met. And
Yes.
this was 2006, 2007, which is an absolute age ago. Tell us about that period of your introduction into veterinary life.
Oh, it was heavy. That was a really tough job, probably the hardest job I've ever had. But at the same token, it gave me so much experience within a year and a half. Like, I probably had 3 years worth of experience coming out of that internship, but it was really hard. And it was partly the hours that was expected of you as a vet, the pretty average pay. Like, I think most weeks we were probably averaging anywhere between 70 and 100 hours a week. And it's totally unsustainable, but it was what it was at the time. And even though it was really hard, I'm still very grateful for that experience.
What did you enjoy most during that period? And also, what did you hate the most other than the hours?
What I enjoyed the most was just this extreme variety of cases. Like, we literally saw everything. The clinic was just so busy, I think, for Australian standards at the time. So we saw neonatal ICU foals, we saw like loads of surgeries, like all different kinds of surgeries, the orthopedics, the colics, obstetrics, and then, of course, with Angus McKinnon there was a really massive reproduction component. So we had really good exposure to collecting stallions, broodmare management and all that kind of stuff. And it was really, like, there was so much to do and so much to learn. That was the best bit. And obviously also working with really amazing interns that were there. And because it was such a big clinic, we had a really good atmosphere with lots of externs coming from overseas, just like you. So that was really fun. Well, the bad bit was probably mostly to do with the intense lack of sleep and stress of the job. As an intern, no matter, I think, where you go. So this is Goulburn Valley aside, but globally, as an intern, you really do bear the brunt of a lot of things. And it's a really stressful position to be in. And you get asked to do a lot and you get put under a lot of pressure, I guess, with the hope that you learn fast. And some people crack and some people persevere. And I persevered, but it was really tough.
Any piece of advice you would give to someone like you about to go into an internship or considering an internship?
I think you have to go in with the mentality that is, if clinics still function the same, I'm 20 years down the line now and almost. And so I think things are probably changing, but you have to go in with the idea that, okay, this is going to be hard. There is no walk in the park for this, but that's why I'm doing an internship. I want to learn hard. I want to learn fast. I want to be good at my job. And I'm going to really give it a good crack. It probably will break you at some point, just the stress of like getting everything done. But just surround yourself with really, people that you can talk to, and when you are having a tough time, and hopefully that gets you through.
Yeah, I agree. Having a good team on your side really helps. So this is the time when you start thinking, hey, lameness is something that you really like. What is it that you like particularly? How does that happen?
I think, like, I've always been quite obsessed, from this young age of the movement of a horse. Like, I just loved watching them move, like how everything works, the position of the limbs, the muscles contracting. Like, it is probably a little bit odd, but they just, they astound me. And Golden Valley, we did lots of lamenesses, and this kind of was the start of okay, I really want to understand, to start solving the puzzle about where these horses are sore. And so that kind of really set me on a good stead to start doing lamenesses. And when I went out into private practice after Goldman, it was one part that I really enjoyed, but I was kind of like, well, I'm kind of getting up to the carpus or the hock, and now I don't really know what to do. Like, I don't think I had a good understanding of more proximal kind of limb-related lamenesses. And I was really fortunate to be put onto the path of ISELP through a colleague of mine. And I went to my first ISELP with her in New York. Or it was Washington, and we landed in New York, and we went to this ISELP, and it was the neck and back. And I got there and I was like, oh my God, like, this is jaw-dropping, the stuff I'm learning in this course. I never knew this area of the horse existed. Like, we never learned about the spine or more proximal kind of, problems in horses very well at school. Like, everything was focused on the distal limb or tendons or, like, the lower limb joints. And I was just thinking to myself, I can't believe it. Like, all these horses I must have, misdiagnosed or couldn't find an answer to, and I haven't even thought about this area. This is so embarrassing. Like, how could I not know about this area? And as soon as I did my first ISELP, I was like, this is it. Like, this is what I've been waiting for. And being fortunate enough to speak some French. And at the time, I was just so motivated. Any, like, professional I would find, like Sudison or, Danois, I went up and I said, in French, I said, bonjour, je suis Anushka. How do I become like you? And he said, you come work for me. And that set me on this path. And I'm so grateful.
So you were in private practice and you decided to apply for an internship at the Ciral. So that's what, 2008, something around that time?
That was 2010. Okay. 2010 or 11, I think now. Yeah.
So that's a year?
Yes. Yeah, I think I stayed just over a year, maybe.
So how does that go? And how does that compare to everything else you've done up until then?
Oh, it was the gold standard. Like, I thought, oh my God, this is just everything I could have dreamed of. I mean, that was also really hard. That was a really hard internship. But I felt, after going to Golden Valley, like, I felt pretty well equipped, being at Ciral. It was quite a challenging environment, at times to work in, because there's a lot of pressure to think hard and fast again and do the right thing as per the protocols. But in terms of the really specific caseload that they had, and at the time, the level and quality of diagnostics, it was really amazing. And these clinicians, not just Professor Denoir, but also Virginie and Sandrine, like, their eye, in terms of being able to assess horses, was amazing. And it just felt they could look at a horse and know where the problem was sometimes. And I just thought, I can't wait to be like these more senior clinicians, just having this really intense level of insight into the locomotion of a horse. It was amazing. And then you couple that with the ultrasonography aspect. So we would spend, like, literally most of the day just watching ultrasounds if we didn't have any primary cases. And we just saw so much, so much. And it was fascinating.
Did you ever consider prolonging your stay in France, either at the Ciral or
very much
elsewhere?
So?
Yeah.
Mm-hmm.
Why did you go back then?
Well, at the time I was being encouraged to apply for their diplomat in imaging. So the ECVM, is it? Yeah. Oh, no, the ECVDI?
Yes, ECVDI.
European College of Veterinary Diagnostic Imaging, yeah. And stay and do their residency. And I was really close to applying, but I had my boyfriend in Australia.
There's always a love story somewhere around there.
There is, yeah. And the other aspect of it, and again, this is not just, trying to nitpick at Cyril, or I think it's any kind of residency program probably, not that I've been to many other universities. But I had this feeling like from the ones that I have visited, a lot of the time the residents looked really unhappy and stressed. And I was like, I've already done this as an intern now twice. And yes, you come out of it with your title. You are a specialist if you pass your exams. But I wanted to, I thought to myself, surely there must be a way without having a title. Like, I'm doing really hard yards now. Okay, I'm not writing or publishing any articles or doing any research, but I've had really great exposure. And do I really need a title to fulfill my, ego? Like, do I need to fulfill this egotistical kind of aspect? Do I need that title to say I'm a specialist? Can I be satisfied with, really just continuing to learn and do the best job I can and be happy with my life? Because sometimes you do look at residents in general and they're just really, burnt and unsatisfied. And they probably come out of it, grateful that they did it all. But I was like, is it worth losing someone that I love for, to give up and do 3 years of torture for that to lose someone?
I would completely agree. I think I've said this before on this podcast. I would do my internship again, eyes closed. I would not do my residency again. And I certainly encourage students and young vets who come and ask for my opinion to think a long time about what their objective is. And I said it's something I didn't do. I just thought it was the only way to become more knowledgeable about something. And I certainly didn't think about
100%,
the after. Yeah, if I was to do it again, I would seek that knowledge in a very different way.
And I think things have changed a lot. Like, I mean, when we were looking at that kind of stuff, so when you were doing your residency or when I was at Cyril, it was really the cusp, I think, of a transition within equine practice anyway. At the time, that was when like the sports medicine kind of residencies were coming through, or like you could get your accreditation if you'd done, X experience in, sport horse medicine and written some papers and things like that. And you could get this kind of, acknowledgement and accreditation because of that, because it was the early phases of the sports horse specialization. But, that didn't exist when I went to Cyril, that residency. And that's really what I wanted to do. And, but now and in conjunction with that, there's so many more continuing education opportunities available, especially in equine, I think, that didn't exist before. Like, it's really incredible the amount of CE you can do online and how you can access that. And I don't think you need to do these residencies anymore unless, you have this burning desire to kind of be at the pinnacle of your career, I guess.
Yeah, absolutely. And I guess it depends also how the profession apprehends the specialist title, i.e.,
yes,
what it allows you to do and what it allows you to claim, and then what owners expect as well. And I guess that applies also a lot to surgeons, where we had situations where we have specialist surgeons and the old school specialists that are doing the old school surgeons who are doing specialist work. I guess that's something that hasn't been completely sort of sorted out yet, which may obviously encourage going one way or the other.
Yeah. I think surgery is probably more, there's definitely components of it where, you do need specialists, obviously, like surgeons, and then obviously we send our diagnostic imaging stuff over to specialists for a second opinion on, and you do need an element of these people that that are providing that service for sure, like without a doubt. But I think you have to be prepared to sacrifice a certain element of your lifestyle to do that. And you need to say, am I prepared to forego, 3-4 years of my life? Like really just forego it to be able to do that.
Considering that you don't go down the residency route, you head back to Oz. Said boyfriend is the one that becomes said husband at the time.
Yeah.
And you guys have 3 children, not in one go, obviously. Tell us a bit about that period.
Yeah, so when I came back to Australia, I was really lucky to have a super supportive boss. I guess I feel like WA was probably, so Western Australia, that is, was, a good 5 years behind, I guess, the level of European standard in equine care in terms of workup and diagnostics. And so I went back and I was like, right, I need this ultrasound. These are kind of the, x-rays that I'm looking at, and I want this kind of quality. And he really supported me and bought the tools that I wanted, which was fab. And I worked at that clinic for 8 years. And yeah, me and my boyfriend, we got engaged, and we got married in 2013.
Mm-hmm.
So we had our 10-year anniversary last year, which is crazy. It just blows my mind. And yeah, I had my first child in 2015.
And so how do you combine being an equine vet and having 3 kids? I know people will be sort of wondering that while listening.
Yeah, it was really interesting because I've always been so passionate about my job. I really thought, and I've never been very kid oriented. And so I really thought, oh yeah, I'm going to have this kid, and 6 weeks later I'm going to be back at work, and that they can go into childcare, and I really wasn't expecting the intensity of emotion that comes with having a child. And that's not to say that everybody feels like that. So I don't want to say if you don't feel like that, there's something wrong with you. That's really not what I want to throw out there, but that was my experience. I mean, obviously, there's hormones and then this massive thing that comes into your life, and you're like, wow, this came from me. And it's a really amazing, beautiful thing that I could never have anticipated to feel so strongly about it. It just, and I was so happy to kind of not be at work and doing on call anymore. And I just thought, oh, I'm never going to go back to being a vet. Never. At the time I was doing a lot of yoga, and I was like, yeah, I'm going to become a yoga instructor. And if it wasn't for my boss, who was so incredibly supportive of me, and he knew how much I really deep down love my job, he was like, just don't do it, Nush. You need to just come back once a fortnight, once a week. I don't care. Just anything for 2 hours, something. Just come back and do something little. And I guarantee you want to come back. But no pressure, just do something. And I think if I didn't have him and the level of support that he gave me, then I wouldn't have stayed in the profession. And I'm so grateful, because it's really, I think, few and far between that you meet such people that are just really so supportive. That's
amazing. I've actually got goosebumps.
He's a really tremendous person, and an amazing friend of mine. And I still talk to him so much because he gives me such wonderful advice. Warwick, if you're listening,
I have to send it to him. So are you in that job? So obviously you go back, thanks to his support.
Oh, yes. Sorry. Yeah. Yeah. So I went back, and luckily I wasn't put in a position where they're like, you can only come back if you need to do on call. I was, again, really fortunate that I could go back, and he said, yep, you don't need to do on call. You just come back and do lameness. That's your thing. And because I'd come back from Cyril with this really strong focus on, more kind of subtle working up subtle poor performance cases or subtle lamenesses, strong focus on neck, back and pelvic pathology. Like I had a real niche that no one else was really providing in WA at the time, I think anyway. And so, yeah, I was able to just have these kind of curated cases that I would come in for and just work twice a week. And then that kind of progressed, the older the child got. So I went back to work when my baby was 11 months old. So that worked quite well for me. And I started out 2 days a week, and then that progressed to 3, and then occasionally I would do the 4th day, which was pretty hard. But it seemed to work. And then I got pregnant again. Now the challenges, I guess, with being pregnant at an equine vet, I'm not sure what the regulations are in France, but I guess I know in Germany that they're a little bit more restrictive. Like I think once you are pregnant, maybe like even teachers can't work from a certain age, a certain gestation period. But in Australia, there's no real regulations around that. But I found I got to kind of, 16 weeks or something. And yeah, I couldn't do nerve blocks, obviously, because I'd be worried about my belly getting kicked. Couldn't do x-rays. So I was kind of like, well, what am I doing here? So I would just help mentor the younger vets. And then by about 20 weeks, I was like, well, there's not really much point me being here because I can't do lameness properly and it's frustrating me. So yeah, I left, at 20 weeks kind of pregnancy with all 3 of my pregnancies, I guess. And they all went back around, they went into daycare around 11 months, so I could go back to work.
And how does that work? I'm just asking in means of comparison, really, on a pay perspective over in Australia.
Yeah, so I got paid like a prorated rate, then so I went from a salary to an hourly rate, then so like a part-time rate, I guess, once I went back to work.
Sorry, you get full pay when you have pregnancy, presumably maternity leave?
In Australia, well, at the time during my pregnancies, if you're the government will pay you 18 weeks of paid maternity leave. And some, like if you're in a corporate, you might have like some kind of other agreements where you get more pay for longer. They have to guarantee your job on return to work. I think, I don't know whether that's within a 12-month period, but I think they have to kind of have a job available for you to return to once you decide you want to finish your maternity leave. But 18 weeks, like that was a real shock financially. Like once the money stopped coming through and we went down to one salary, it was like, oh, this is, this is hard. Yeah. But luckily, I had a partner he's earning pretty good money as an engineer. So we were able to kind of, still have me being at home and looking after the child, while he was the only one working.
And you figured hourly rates for being a yoga instructor might be above what people might be willing to pay?
Probably not. Probably not. I think definitely as a vet you do get paid more from what I hear. I'm so glad. Like I can't thank work enough for kind of pushing me forward to come back, because really it is something I'm just so passionate about.
So you stayed in that practice. You had your 3 children while staying in that practice? You'd moved on already? No, you were still with them.
I left when I was pregnant with my 3rd, and that's when my husband got this job offer in Melbourne. And I thought, well, it's number 3 now. Stuff's like, it's getting real. Shit is getting real is what you'd say in English. It's not going to get any easier. So I don't know when I'm going to go back to work. And so we just took the leap and ended up in Melbourne. And it was kind of good for a little bit, and then COVID hit, and we were in like this city that was like the most locked down city in the world, and it was really hard with 3 kids at home.
Oh God, nightmare.
Yeah.
Up until then, you were enrolled in the ISALP course. You were still doing ISALP?
No. To be able to sit for your ISALP exam, I think you have to finish all the modules within 5 years, and I did that while I was in Europe. So like I started before I went to Siral, and then I finished off the modules while I was in Europe, and I think maybe one after I left Siral. With it, so my intention was initially to do the exams, and it's quite a rigorous process. Like you got to collect your cases, and I really struggled with getting part of the big part of the ISALP presentation, like of your cases, is to do the follow-up management. And I really struggled in WA anyway to get really good follow-up on cases, I guess, because a lot of the stuff I was seeing were the more complicated cases didn't always have the best prognosis. And so like asking a client to come back when, they might not have a good prognosis on their horse was quite hard. And I just didn't get the case numbers or have adequate follow-up on my cases, I think. And so I was like, oh, this is too hard. I don't have the mental space for this. And again, it was one of those things. I was like, okay, well, it's nice to tick the box, but is it worth the stress? I would have liked to have sat my exams, but it just didn't happen, and I'm okay with that.
You also enroll or start doing some courses in Germany, or certainly a German chiropractic course. Is that the same period, or was that following your move to Melbourne?
No. So, I was really early on pregnant with my third at the time. So I guess I'd gotten to this stage where my focus a lot in practice were neck, back, and pelvic related problems. And I was, seeing a lot of lesions, and I always really struggled to put them in context of how do I really know if what I'm seeing is really pathological for the horse? How do I know if this, arthrosis of a lumbar facet is significant or not? And I really struggled with that, not having kind of like this, manual sensitivity, I guess, of to be able to really feel and understand what the horse is feeling, I guess. And so I'd be working really close with sports massage therapists to try and understand the soft tissue aspects. And I kind of got really frustrated for myself, like, okay, how can I understand really what the horse is feeling? I see a lesion or something that's not normal, but I want to know more about whether it's something that is an issue for the horse. And so that's kind of what led me on to chiropractic, to have a better understanding, I guess, about how the interplay of, spinal lesions and the presentation of horses. And so having a German husband, I was pretty lucky for us to go back to Germany quite often. And I found out about the IAVC, and I started going to their courses, and I think I got 2 under my belt before COVID hit. And then I went back and finished off the other 3 modules, like over a couple of years, just, with COVID and pregnancies, it was a little bit tricky, but they were really wonderful and supportive of me finishing as well, which was great. And so, last year I finally I'd passed all the written component, but I finally passed my practical component last year, which was wonderful.
Oh, well done you. Could you give us a little bit of a definition of what chiropractic is, and maybe what the course involved, what you learnt, and how maybe it helps you today?
So I look at chiropractic as when I started looking at chiropractic, I would hear people talking about chiropractic and talking about subluxations and be like, ugh, chiropractors are so dumb. Like, things can't be subluxated. Like, it's really silly. but I wanted to learn more regardless. And I was really pleasantly surprised, when I got there, because the definition of what a vertebral subluxation actually is not what most people think it is. And so, there's a really wonderful definition provided by the Rubicon Group at what a vertebral subluxation is. And so I will just read this one through because I find it quite concise. So they define chiropractic subluxation as a self-perpetuating central segmental motor control problem that involves a joint, such as a vertebral motion segment, that is not moving appropriately. And so this results in maladaptive neuroplastic changes that interferes with the central nervous system and the central nervous system's ability to self-regulate, self-organize, adapt, repair, and heal. It is a really big, definition to digest. But I guess in simplistic terms, the way I see motion disturbances within the spine is an interruption of messaging along the spinal canal. And when there is a lack of movement or an impingement of sorts, or the information coming into the brain is not necessarily going to be correct about what's happening in the surroundings, and therefore the brain can't put the proper motor output out if it's not receiving a proper sensory picture of the environment. And that's the best way I like to look at chiropractic, is about a flow of information. It's not about putting a joint back into place, because we know that that's not what chiropractic is anymore. We know it's not a joint out of place. It's about providing a direct sensory nervous input into a particular area that is not moving appropriately, to try and stimulate the local nervous pathways and also have a direct effect on the brain. It took, being very fresh to chiropractic, it's taken me a while to get my head around it, obviously, and being able to actually, when somebody's saying it to you, you're kind of like, yeah, wow, this is really cool. And then being able to actually understand it and verbalize it has taken me a bit of time to, get the right lingo or the right words to describe it in the best way I can. Yeah.
And what would you say it's changed in your approach to lameness and poor performance?
Yeah, so I think it definitely gives me a much better holistic kind of view on my patients. So coming from Cyril, their standard of physical examination was intense. We would spend an hour looking at horses just at a stance and documenting every kind of effusion or soft tissue thickening or abnormal palpation before we presented it to the senior clinicians. And I used to think I could palpate a back, after coming from there. And I used to think I could give an opinion about how a spine is mobilizing from the ground. But when you start to really feel how an individual motion unit is moving, when you learn these chiropractic techniques, it just provided me with a total another level of information about the function of the spine. And I think it's really, the protocol with the IAVC was wonderful in the fact that after every module you had to go and do case studies and palpate X number of horses, and so I did get a lot of, just what we call motion palpation, feeling how the spine is moving. So not doing adjustments, but trying to understand the variation between individuals and what you think might feel restricted. It really just provides a strong level of information about spinal function, what the muscles adjacent to the spine are doing, and trying to have an opinion, I guess, on, okay, could this sort of muscle spasm or restriction in motion be a primary thing or secondary thing? That's where we use our diagnostics, obviously, to try and differentiate. But the palpation findings from when I'm up on my chiropractic box and mobilizing the spine is dramatically different from when I'm on the ground and mobilizing the spine. they're two really different things. And I think then when you put that in context with the clinical picture of the horse, how is the horse moving in hand on a lunge? How is the spine moving, lifting, bending? Is the horse moving freely in its, cervicothoracic range of motion? Like, it really helps piece together all this information in a totally different way. And then when I've finished looking at a horse, I can present to the client, with my veterinary hat and my chiropractic hat about the best way to proceed forward, and then they can make a educated choice, I guess, based on the examination findings about, how much they want to spend. A lot of horses in Australia are uninsured, so they have to kind of make a lot of financial choices. And then when we do go to the diagnostic process and they do want to go down the line of further imaging, then we can really piece together, the clinical findings or the physical findings and the diagnostic findings really well. Yeah. It's really enhanced my, ability to provide information to clients.
And I guess then proceed with a more specific, appropriate treatment from what you're saying.
Correct. 100%. And the problem is then once I started doing a bit more chiropractic, after a year of doing quite a lot of chiro kind of related stuff, then I thought, oh, there's so much soft tissue stuff that I'm seeing now. Like I want to know more about what the muscles are trying to tell me. Like now, okay, I can palpate the spinal mobility, but what are the muscles really trying to tell me? And then, that led me on this other path to be like, okay, now I need to learn more about soft tissue and muscles and rehabilitation. And so that's kind of been like the next step of the journey, is trying to really understand, or integrate, I guess, the neuromuscular aspects, as well, like of what I'm palpating and feeling. Is this really kind of spine related or facet related, or are we dealing with, a muscular spasm that could be something to do with the spine, or is it maybe compensatory for the movement pattern of the horse? I think those are the things that we try and understand a little bit better now.
And so these are the modules that you're doing with the animal biomechanic group?
Yes. So that's ABNR, Animal Biomechanics and Rehabilitation. And that's also a group in Germany. And the modules with them have been really fantastic. I haven't done all of them, but last year I did a myofascial course with trigger point needling, and that was really eye-opening. It was really a fantastic course to do, and neural therapy.
It all sounds pretty fascinating. And I'm sort of back in my mind going, how do you fit all this in? But my first question is, at what point did you decide to set up your own practice? Because obviously COVID hit, you'd just been in Melbourne, you just started in Melbourne. You had your third child at that point. What was the plan?
Yeah, so I managed to find work with a really interesting guy here. He's a veterinary farrier. His name's Luke Wells-Smith. And I've been working with him, and it's been going really, really great. Our focus is on, at his practice, Motion Equine Centre, has been on similar principles, kind of like what we did at Cyril, in terms of pre-season kind of performance horse assessments and trying to screen horses at the beginning of their competition season or even during, as a kind of more of a proactive approach to musculoskeletal problems in horses. And so we kind of do a performance kind of horse package, I guess is what you call it, where we do a gait analysis, a podiatric assessment because he's a veterinary farrier, a chiropractic assessment, and then piece it all together for the owners and make a plan to go forward. And that's been a really great thing to be working on with him. And it's really interesting working together because we really come from totally two different aspects of the horse. He comes from the neck, the foot, and goes up, and I come from the neck and back and go down, and we meet somewhere in the middle. It's been really great working there. But I have moved house. We bought a house in Melbourne, and it's quite far from the clinic. And so having the juggle of 3 young kids, and I really wanted to do more work, but the logistical challenges. So I drive an hour to work at the moment. And with 3 young kids, it's really challenging, that kind of commute, especially when we have these complex cases and, they might take 2.5, 3 hours to work up. And you have this kind of pressure that you want to deliver on the day. So do everything possible on the day. And so, I found it quite challenging being that far from work. So the idea was to start up my own thing. So I'm still working there 2 days a week and have my own business in my area that I live in Melbourne on the side. And it's morphing. It's really evolving, weeks at a time. Actually, I had this one idea that it would be something, and it's shifted away quite dramatically from that quite quickly.
Can you tell us a little bit about that?
Yeah. So, I guess I had this idea that I would just do gait assessments and chiropractic treatment. And I guess a lot of people here, they expected that I was just like your standard chiropractor. I'm not sure what the legislation, if there is any in France or the rest of Europe about, what chiropractors are and, what they're allowed to do and what's the definition of chiropractic treatment. But here there's no real legislation around it. So a lot of, manipulators, people who do like to crack things and say that the hip joint's out and, this bone was out and put it back into place by making lots of loud cracks, they still exist. And so I think there's a bit of a warped definition about what chiropractic actually is. And obviously there's a different, financial aspect to it. So someone who may not have as much education will not be charging as much for their services. But I've made it pretty clear to clients that I will only do chiropractic after doing a full workup. I'm not just talking about, trotting out once or twice and just watching a lunge really quickly and just saying, oh yeah, it looks out, or pretending that I think it's out because of just a spinal thing. I really want to know if there's a limb problem, then I need to work it up properly because that's my vet hat. And then we can always come to chiropractic as a management tool. And if we think that there's something primary going on in the back, then we come and look at it diagnostically afterwards. And so I guess my price point was not really, I guess, what people wanted to pay initially. Like I got a lot of pushback from, a lot of interest initially because people were wanting to know about my skills and services, but then they weren't wanting to pay for that service at the price I wanted to, because I wanted to do the gait analysis using the Sleep app, and then do the chiropractic and myofascial treatment. So it's kind of morphing a little bit now into providing more of a full spectrum equine service with a, more lameness focus. So I'm not providing after hours or anything like that. But, starting to offer, more in terms of medicines. Okay, when I go out there and I see your horse is actually lame, now I'm going to start doing a workup on it instead of asking you to come back to a clinic which is quite far from you. It's more of a field service, I guess, and getting some equipment through. So it's when I initially thought out, oh, this is going to be really low maintenance. It's not going to cost me anything. I'm just going to have my chiropractic box and it's going to be great. And I realized very quickly it wasn't going to be a very profitable business plan to just do that. It wasn't really generating a lot of money and people were quite hesitant to pay for that. So now I've realized that I need to add services that generate more, more income, providing joint blocks and medications and all that kind of stuff. There's the add-ons that come with that, and then obviously the diagnostic imaging as well. So
do you think that maybe that after a little bit of time of your name getting out there, people knowing you, that you might it might evolve again and then morph back towards what you initially thought?
Yes, I do. Yeah, because it's hard because I came from WA or Western Australia where a lot of people knew me. And so I did have a bit of a reputation already. And where I'm working, yes, we've got quite a niche clientele at Motion Equine. And I thought more people in my area might know who I was, but it turns out no one knows who I am. So I've really had to dig deep and really I'm trying to put myself as much out there on social media as possible, just trying to get a bit of a known face to who I am. And then, just really relying on providing high-end service to the clients that I've got to hopefully get those referrals through. But the feedback that's coming, everyone that has booked or started booking with me has booked revisits. So that, has buoyed my confidence a little bit. And the feedback's starting to come through now, especially with these horses that are rehabbing, or we implemented kind of like slow and steady rehab plans. The riders are starting to come back on them now. And, in the last week, 3 clients have fed back to me like, wow, we're just so happy. The horse is moving so well. Like, we're so grateful we found you. And, now that kind of feedback's coming, it's like, yes, let's do this. I'm all in, but it's hard.
Yeah, great. Congrats. Because when did you start? How long ago?
Just at the end of October.
Yeah. So, wow, that's like a matter of months really. So.
Yeah. But it's so funny because when you're in it in the early phases, you're like, oh my God, this is the worst. I'm a failure. No one's ever going to use me. This is really hard. And it is really hard. But I've just got to keep reminding myself, baby steps. You've just started. This is going to be a complete functioning at a loss by the end of this financial year. Like, it is really going to be tough. And, I've just put in for my first, equipment loan this week. And it's like, oh, am I going to meet my repayments?
While we're on the sports performance side of things, you said something really interesting, I thought, in your bio about the fact that your own physical fitness helps your clinical perspective. I'd love you to elaborate on that.
Yeah. So, I'm a bit of a weirdo when it comes to problems that happen in myself. I get really excited by them. I'm buoyed by like, this must be what a horse is feeling. Like, I strained my Achilles and I'm like, oh yeah, that must be what a suspensory feels like. I could feel like the fibers like kind of, tearing a little bit, and now this is going to be my rehab and this is what my patients are going to have to do. And especially when it comes to back pain, I think this is the hardest bit, because we can postulate as much as we want about what we think a horse is feeling or any animal is feeling and where exactly that pain is coming from. But my own experience is that unless you can really verbalize, the sensations that you're feeling and in what movement pattern something is hurting, it's near on impossible to say with certainty it's coming from one particular area, I think. And so having that experience of, such intense pain in terms of back pain and realizing how much muscular spasm interplays with that, it's really given me a fresh perspective on, I guess, what our patients are kind of feeling. And so, it's hard being for me anyway, after having 3 kids and, you put on 20 kilos of weight and then you get back into fitness and you're like, okay, I have no core strength. But you really do realize how fundamental that is to our overall locomotion and stability. And I'm really driven by that and trying to understand, okay, when I move in this way, I feel, or when I turn my core on, I feel like how it alters my strength or power. And I try and put that in the context of what we're asking of our horses when we're sitting on top of them and asking them to do these really amazing movements. And so, yeah, I go to the gym. I have a small group fitness studio that has amazing trainers that are highly motivated, and they foster this really intense environment. They don't drive it, but the people that are there are so driven by the passion of these trainers that it's a really crazy studio, I think.
Before I ask you the question of how you juggle your time, I know you also translated Professor Denoir's latest biomechanics book.
Yes.
How did that go?
Yeah, I think I was actually pregnant with my first child when that happened. So I was lucky to have a fair bit of time up my sleeve. And oh no, yeah, translating that book was pretty intense, and it was just off the back of having worked in France. So I think I took actually 2 weeks off from work to try and bang out as much as possible. And yeah, because when we were in France, I was working in French. I had to do my reporting in French. I had a pretty good grasp on veterinary equine French. So translating that at the time was not too bad, but obviously there was a tremendous amount of mental pressure about making sure I did Professor Denoir justice with his words, because he's got almost a poetic way of writing, and he is very intricate in what he describes and sees. And so, yeah, it was quite tricky and challenging I find, it was hard to translate that poeticism into English almost when you're talking anatomically and biomechanically. Like, that was quite tricky. So I hope I did it justice. Yeah, it was tricky.
So coming back to the time question, because again, I think it's something that vets in general struggle with, this kind of work-life balance. Do you have like set rules that you go by, or just do as much as you can, go with the flow? What sort of advice would you give?
I think it's so, I think on that note, it's really hard to give advice, especially when you have a couple of children, because the juggle is real. It's really hard to find time for everything. And I can't give advice actually, because I haven't found what works for me. I feel like I'm constantly trying to squeeze as much in as possible. As soon as I don't have a child around me, I'm like, right, I'm going to do these 500 things. And yeah, it's very hard. The one bit of advice I would have, and is something that I'm going through personally now, like talking to someone about trying to manage my stress levels, is to be kind to yourself and accepting your own personal limitations, not as a failure, but as it's okay. It's okay that you can't do it all. And hey, let's look at what we have achieved and be kind and say, that's great. That's good enough for today. And that was the best I could do. And let's tackle a new day tomorrow.
I think that's a very good mindset.
It's really hard with, 3 young children, especially like my youngest is 4. And so they're still quite at that age. They're pretty demanding and intense. And then trying to start a new business has been a lot of pressure as well, like trying to feel like I have to do it all. And in a way, I kind of really I'm financially limited by it. I really do have to do it all because I can't pay other people to do it for me. So I guess that's the only, not the only, but one benefit of, motherhood and parenthood is that I've learned to be sleep deprived in a way. And so my sleep deprivation is just continuing on because I try and do stuff as soon as the kids are in bed. I stay up and work and try and get stuff done. But it's tricky to find time for everything, to put everything in your day and still be present as a parent and be able to provide to clients and then look after oneself. But I think that's where this exercise has been really important for me, is making sure I do have something for myself. Because if I didn't have that, I think I would actually be slightly crazy.
Yeah, because that's often the first thing to go. I think when you talk to women,
It
anyway.
is like I don't have the time for this. So yeah, like I've been lucky that my jobs have been pretty flexible in terms of starting hours, because my work is so far away from me. I don't start till 10 o'clock in the morning. So I can get my kids off to school like without putting them in before school care. And then I work a 6-hour shift. And so I've been lucky to have flexibility in my jobs I can dictate my workload because I've got quite a niche area that I'm focused on. So that's been quite nice to have that situation where I've got something that the employer actually really, needs from me, and I can almost have a bit more flexibility in the type of work I do.
Well, I think we're almost coming to the end of this podcast. I do have couple actually last questions for you. The first one is, if you had the young, enthusiastic Anushka fresh out of vet school in front of you, what would you tell her?
Do it all again. In a way, I feel like the only thing I would potentially change, but I think this was a factor of the times, accessibility to doing a residency and stuff like that. The egotistical part of myself that likes to be perfectionist would have really liked to have done a residency, but it wasn't surgery because I'm not a surgeon. And I realized that pretty quickly when I started looking at surgical residencies. I don't want to cut colleagues. If there was a sports med residency when I was fresh out of vet school, that would have been what I would have been going for. But you can't hurry these things. And so I kind of have no regrets on the path that I've gone on. The only thing, it's been quite expensive, I guess, going overseas a lot to get continuing education and all that kind of stuff. So, but professionally, I feel very fulfilled, and I think that's the most important thing.
Do you do any teaching in Australia?
Yeah, so I help out a little bit at the Melbourne University with their young vets, first and second years doing anatomy. So that's another thing that I brought from Cyril is this real passion for anatomy of the skeleton, because it's so essential to understanding ultrasonography. When you have a really detailed insight into the anatomy, then you can almost visualize in your head what it looks like and then translate that into the ultrasound. It's a real 3D kind of picture that you need to put together, I guess, in your brain or in your mind's eye.
And you're enjoying that?
Yeah. I just signed up to do a couple of classes this year, which is good. And I mean, down the line, I think part of the reality is that I keep thinking, well, what am I going to do when I'm 60? Do I really want to be flexing up horses and nerve blocking them, putting my body at risk? And I guess that was another reason to kind of go down the chiropractic path too. What's something potentially more gentle on my body? As I get older, what can I see myself doing? And I think, helping young vets learn would be a really great way to go. And, if I don't end up having a business that expands out and ends up, if I don't end up being a practice owner that, has a practice that is ongoing after I decide to finish, then I think, teaching is a really nice area to be in, to help educate and give young vets something to be passionate about.
Continue to teach the profession. So, Nush, is there anything that we haven't talked about that you'd like to chat about today?
I feel like I didn't really touch on, you did ask me about the structure of the chiropractic courses, and I don't know if you want to know a bit more about that.
Yeah, sure. Go
Or
ahead.
if it's
Fire away.
Yeah, so in terms of the IAV course structure, it was 5 different modules that were in person. So it couldn't be done online. And I think that kind of sets it apart from a lot of other courses. And each of the modules weren't just a 2-day course, like it was a Wednesday through to Sunday, sitting down, listening to lectures, or, doing palpation sessions with, really quite educated instructors. And yeah, each module was just so intense and such a wealth of information. Like I really felt like I came out of it super prepared. And it was, divided into 5 different regions: sacropelvic, thoracolumbar, cervical, extremities, and then the last module was an integrated module. At the start of each module, you had an exam on the previous module's content, like just a multi-choice one. It wasn't just about like anatomy of the spine and adjustment techniques. They had some really fabulous lectures on neuroanatomy, and I guess really diving back into the fundamentals on neurology, which, I hadn't really touched on since second year of vet. And so it was just really fab to be, integrating, I guess the manual aspect and really the scientific aspect of what chiropractic actually really is. And it really felt so fulfilling, rather than just thinking, chiropractic's putting something back into place. Really felt like, yes, there is a science to why we are doing this, and these are the benefits that I'm hoping to deliver my patients.
So you talked about regulation actually when you were first chatting about it. So over here, and I'd be interesting to hear your view on things. So over here, we're very much about osteopathy, and that's actually sort of included and accepted a profession as part of the veterinary profession, but not at all the chiropractics. So what's your view on that?
Yeah, to be honest, I don't know a lot about osteopathy, but my understanding is that it deals a lot more with, the systemic kind of vascular and lymph than, purely just a spinal perspective, which, again, it's another holistic perspective. And I think all these techniques have their own place. And obviously, osteopathy has a really massive following. I've received osteopathy myself and I really enjoyed it. And I think it's so hard to, I guess, give an opinion on something unless you've really experienced how that therapy makes yourself feel and whether you actually believe in it as a therapy. Does that make sense?
Completely.
And yeah, if I had an exposure to a course in osteopathy in Australia, or if at the time, when I was trying to find another path to understanding what I was feeling or seeing in horses, if that kind of education was available, then I probably would have looked at it seriously as well. Like, I think you could do one or the other and not be in a wrong position. I guess the thing is that there is always so much learning to be done, and there's no one right way to look at a case. There's so many different aspects. I mean, unless it's like an obvious, fractured bone or and that's the only, criteria. But, you could say, okay, well, let's look at the backstory to this horse. What's led to this point? Why does it have these arthritic conditions, or why is this tendon, disrupted? What was the lead up to it? Is it a compensatory movement pattern? And then where is the primary problem? Like, it really is a rabbit hole that you could go down in terms of analyzing your patients. And I think I've kind of come to the point that, okay, these are the tool sets that I have now, and at one point I was kind of like, well, what am I now? Am I a vet? Am I a chiropractor? Am I a massage therapist? Like, what is this? What does it become? And so it can become really quite confusing about what our role is. And so, I think you choose one or maybe a couple of different paths that you like to integrate together, and otherwise, it just gets too confusing. I don't think there's any wrong way you can go about it. And if what you're doing resonates with your philosophy and how you feel it affects you as a person, then that's the most important thing, because you're standing by your opinions and your ethics, I guess.
Yeah, that's a really interesting and sound take on things. I get the feeling sometimes the race for more knowledge is also covering up a lack of confidence, maybe, and also the perfectionist streak that you talked about. I think that's quite common in the veterinary profession.
Yes, very much so. Yeah, and I mean, like, I'm 100% guilty of it myself. Like, that's probably one reason why I can't be a surgeon, because I'm afraid of doing it wrong. Like, I just don't want to screw anything up. And, I mean, the same could be said for whenever we're, assessing a lameness, or, assessing the biomechanics or interpreting a gait analysis. The same thing could be said, but it doesn't affect me that way. Like, I don't know why, but, I just feel really passionate about it and trying to piece together multiple pieces and try and give clients a more holistic kind of picture on what is going on with their horse, rather than solving an immediate problem that I have to, like, be really perfect on. I don't know. It's hard.
It is hard. It is hard. And I think sometimes it's reassuring, maybe for the younger vets listening to us out there, that, okay, it's an ongoing trip down the learning road.
Yeah, 100%. And if you enjoy learning and you're passionate about your job, no matter what the job, that's probably the most important thing. And clients, I think, genuinely appreciate that when you're, one, passionate, and two, when you reach the end of your knowledge, and you are open with them and say, look, this is something I haven't experienced, or I'm not sure, I'm going to consult with specialists. I think in Australia anyway, clients really genuinely appreciate that openness and appreciate your effort to try and get to the problem, or get to the bottom of the problem with their horses or their patients. And I think it's okay to say, I don't know. And be kind to yourself about that.
I have one last question that you're going to laugh at. You talked about bushwalking. Bushwalking is literally just walking in the bush, or does it have some kind of other obscure hidden meaning?
No. Nah, the bush is, I guess, as soon as you get out of the city, and we've got all these beautiful tall eucalyptus around, and lots of really nice rugged landscape. Being out of the city is what I would define as getting into nature and then going and exploring and seeing what we find. And especially Victoria, it's a really wonderful place. There's a real diversity in landscape, and I've tried to instill like this love of nature with my kids as well. We do bush play groups where we go into nature and we just look at the environment and just try and really be present about where we are and what we're seeing. And getting into nature and connecting with nature is something that is able to really calm me down and make me feel settled and at peace. And this thing of just trying to find new places and get a really nice surprise when you see something that you weren't expecting, because you kind of get off the beaten track, is something that excites me. I like going and exploring and being intrepid, I guess.
Applies to your life in general, I get the feeling.
Yeah. I can't help myself.
Well, thank you very much, Nush. It's been a real pleasure. Really, really interesting.
Yeah, it's so good to chat to you again.
And if anybody wants to contact you, is it okay if we forward you their messages?
Oh, 100%. Yeah, no problem at all. Yeah.
Super. We'll sign off here, and thank you for everyone for listening.
Merci d'avoir écouté cet épisode de Veto Micro. Si le cœur vous en dit, partagez-le à vos amis et à vos collègues, abonnez-vous au podcast et mettez-nous une note de 5 étoiles avec un gentil commentaire. C'est ce qui nous permet de remonter dans les classements et de donner de la voix à la profession. Si vous souhaitez participer à Veto Micro, nous suggérer des invités ou tout simplement nous écrire, faites-le sur l'adresse podcast@temavet.fr. Prenez soin de vous et à la semaine prochaine pour écouter une nouvelle façon d'être vétérinaire.